was probably in your house.
Thanks everybody for coming. Good morning. We have some wonderful rain outside we brought in for the occasion today, so glad to be able to do that. I'm Michael Chambers. I'm Vice President of Operations here at Central Kansas Foundation and the campaign chair for the Pathfinder at 50 Capital campaign, which is why we're really all here today, to launch the public phase of our campaign. We have some of our board members here, CKF board members, and some of our Pathfinder at 50 campaign leadership committee members here today, so thanks to all of you for coming. And then we've also invited some of our colleagues from the community today to talk about their relationship with CKF and why they've chosen to support the Pathfinder at 50 campaign. Pathfinder at 50 is a $2.5 million comprehensive capital campaign with the goal of helping more people find their path to recovery. And we hope to do that in 3 different ways. Number one, by raising $1.5 million to expand our residential detox and treatment capacity, by raising $500,000 to renovate the Pathfinder Recovery Center here, and by raising another $500,000 to endow Central Kansas Foundation for future generations. So those are the goals of the campaign, and that's why we launched it in 2012, and we're going to talk a little bit more about the numbers later, but that's why we're here today. So I'll be introducing each of our speakers as they come up, but before I do that, I'd like to introduce Les Sperling, CKF's Chief Executive Officer. Les?
Hi everyone, I just want to echo how nice it is to have everybody here today, and it's a humble experience to be with CKF. 48 years ago in May, a homeless alcoholic died in a motel room in Salina, and about 7 citizens of Salina decided that that wasn't appropriate, and they banded together and formed the Central Kansas Foundation. And we've been working every day on that same mission for 48 years. It's an incredible time for us. We would love to be out of business, actually, but unfortunately we still have a number of issues that we have to deal with. We do so much work with families and with people who suffer from substance misuse and addiction, and what we really have to offer each day is hope, and the hope of recovery and the path to recovery. And I think if you look through the 48 years that we've been here in Salina and other communities, you will see throughout our community people who are successful as a result of coming to the Central Kansas Foundation and now play leadership roles and key roles with their families and their communities. A lot of our work means that people get their families back. They get back to work, they improve their health, and we're just excited to be working with so many community partners. We're fortunate to have a visionary medical community that we're working very closely with, a great criminal justice system, and other social services that we work with each and every day to wrap important services around for everyone. I just want a little brief history. In 1997, CKF built and started to operate a 10-bed detoxification and residential service. In 2005, we expanded that to 20 beds, and now in 2015, we want to move to 30 beds and do a better job of providing access on a regional basis for detoxification services and engagement in treatment. So we're very happy about the prospects of our future, and we just deeply appreciate the community members who have helped us every step of the way. Thank you.
Charlie Grimwood is Vice President of Regional Development at Salina Regional Health Center, and he's going to share a few words with us this morning.
Good morning. Good morning. The mission of Salina Regional Health Center is to improve the health of people who entrust us with their lives, and CKF has been a key partner in that for, of course, a very long time, but particularly since 2011. Les approached us to look at how we could partner more closely to provide services for people with substance use disorder. And out of that arrangement, which is now entering its 4th year. CKF's been providing on-site services in the emergency department at Salina Regional to screen, assess, and help place patients. They've been providing on-call services 24 hours a day for that period of 3+ years. They provide a full-time case manager at the hospital, Eddie, who assists our staff with treatment planning, with discharge planning, and with care coordination for patients. And CKF also helps facilitate transitions of patients from the medical detox services at the hospital to the medically monitored services of CKF. So that relationship has been really powerful in improving the care that we're able to provide at Salina Regional. This is a very unique arrangement as we look across the country. The relationship between our two facilities, I think, is very unique to what we're doing here in Salina. And through this arrangement, CKF, if this is a typical year, we'll see several hundred patients at Salina Regional and have well over 1,000 patient contacts through that relationship. So CKF as an organization, and I particularly credit Les for the vision of what that relationship could become. CKF's really been tireless in improving those services and helping us as a regional hospital. And in fact, CKF is now a member of a group called the Sunflower Health Network, which is a network of 17 hospitals in central and north central Kansas. And CKF has joined that group of hospitals with the intent of doing things beyond Salina with hospitals throughout this part of Kansas. So, but behind those numbers and all of the arrangements and processes we have going, what's really important to me is not the number of patients, but the fact that any one of those patients, we could be saving a life together with CKF, or we could be saving the lives of other people in that process. So I think that's that life-saving is what we do. And between CKF and Salina Regional, I hope that's something that we can continue. So that's why we at the hospital enthusiastically support this capital campaign. We think it'll be great for the people of central Kansas, north central Kansas, and ultimately it will save lives. So we wish CKF the best in this campaign. Thanks.
Dr. Rob Freelove is the Chief Executive Officer at Salina Family Healthcare. So welcome, Rob.
Thanks. Good morning. I'm going to speak from a couple different perspectives, actually. First, as a physician, substance use disorder is a difficult thing to treat, and it's an often unrecognized problem. And a lot of times, the first time we get an idea that somebody has a problem is when we have them in the hospital for something, and they're not able to use, and then they start going through withdrawal. And the program that is there at Salina Regional Health Center as a physician is invaluable. To have Eddie there and have immediate expertise there to help us with that, to help us manage patients, and then beyond that, help us with that transition of care from that acute care in the hospital to outpatient treatment. I think it does speak volumes to the resource we have here in CKF, and I think that's another thing, maybe what I've come to appreciate over the last several years is what an incredible resource we have in this community in Central Kansas Foundation. And I also give a lot of that credit to Les. The things that we have been doing together in collaboration really were things that Les came to us and said, hey, what do you think about this idea? And they're great ideas. And right now, probably the main project that we've been working on for about 3 years now is we actually have a substance use disorder counselor in our clinic full-time, employed here by CKF, but over at our clinic full-time. And we have, as family physicians, we believe in prevention, not just treatment of acute illness and chronic disease, but if you can find ways to prevent things from escalating and getting worse, then you're probably saving money on down the line. And that's really what we're working on with CKF is we're doing universal screening of all of our patients for risk for substance use disorder. And if they screen positive, then we have immediate expertise, somebody to come in and actually work with that person right there to try and intervene either before it becomes a problem, or if it is a problem already, to intervene and help us manage that, and then in turn manage all of their other health problems. I think that's one of the other things when we think about substance use disorder. Everybody kind of sees the person in the movie, you know, the addict in the movie that's kind of has that stereotypical, everybody has that stereotypical image in their head. But I mean, these are everyday people. They're people who go to work and are parents and grandparents, and they have other health problems that are impossible, if not impossible, incredibly difficult to try and manage until that substance use disorder is treated effectively. So we've been very fortunate. It's been very successful, and we also are very strongly supportive of this effort. We want CKF to be here for a long time and to grow and expand and find other ways for us to collaborate and treat our patients and provide more encompassing health care for every single individual that we take care of. So thank you, Les, for that, and good luck.
Linda Benjamin is a CKF board member and a member of the Pathfinder 50 Campaign Leadership Committee. She's also a school counselor at USD 305. She couldn't be here today for a couple of different reasons, but she did ask that I share her notes that she sent over. And Linda says that she's been a witness to many lives affected by substance use disorder. She recalls their faces when she thinks about those that are affected. She sees her students, their friends, brothers, sisters, parents, aunts, uncles, and grandparents. And she sees the consequences of failed attempts to get an education when substance use is involved. She has seen teens struggle and drop out of school, and she's seen young children that are not able to attend school because their parents are using drugs or alcohol. She sees the pain on family members' faces on a daily basis in her work, and she's seen lives that have been lost as a result of addiction. She indicates that having CKF as a community resource has been life-saving for individuals that she knows of and family members in the community. And she knows that when she refers a student or a family member to CKF, that they'll get the services that they need. And she says she's a grateful supporter of CKF, and all of us that work here know that. She's a very hands-on board member and very much a part of our day-to-day work. So thanks to Linda for all that she does. Annie Grevas is the director of the 28th Judicial District Community Corrections, and she's going to talk to us a little bit today about our relationship and the work that we do with them.
Good morning. He said I'm Annie Grevas. I'm the Director of Community Corrections. And unfortunately, I've been in this field for about 28 years, and I think I've worked with CKF for the full 28 years. As you know, Community Corrections services high-risk juvenile and adult offenders. And the key to our program is to reduce recidivism. We want to stop the crime rate. We want to stop continuing crime. 80% of the clients that come to our office, both juvenile and adult, are drug addicted. And without CKF and the services that they provide, I don't know what we would have done. From the beginning, when it was just a small little building of outpatient services and they went there once a week, to today where Pathfinders is open all the time for offenders to come in here any time of the day, to find a peer coach, a mentor, someone to talk to when they're really needing that is invaluable. One of the things that we've seen with CKF is their willingness to partner. The offender world is not the most popular world. People don't want to give money to offenders. They don't want to service that population. And yet those offenders are in our community, they're working, they have families, they have children. And when we ignore that and crime continues, we're not helping the community. CKF would never took that stance. CKF partnered with me on multiple grants. CKF now allows one staff member, Dawn, to come into my office twice a week, sit there and wait for us to place offenders with him, to do some peer mentoring, some coaching, different things. CKF partnered with us very closely with our drug court. We started drug court back in 2013. It's changing the lives of multiple offenders across this community. We are going to have our first graduates, 8 offenders, that were daily meth users, were unable to function in the community, had their children taken away, did not have livable lives, and are now working, have their children back with them, and are doing things that you would never dream they could do before. But without CKF and their willingness to provide us with staff on a regular basis, weekly, without CKF saying, yes, you may bring another person to detox today, we'll open up a bed, we'll work it out. Without CKF telling us, absolutely, this person needs to go to inpatient, we'll figure out a way to make it work. Without those resources, we wouldn't be able to do what we do today. These people in our community would continue to be drug addicts, and they are changing the lives of these people. And I can't tell you, not only are they a resource to the community and to the offender population, they're a resource to my staff. My staff know that we can call them 24/7 and get the services that we need for whoever it is. We get calls all hours of the night, and if we need someone at CKF, I can find them. So I thank you, Les. I thank you for all the time you've spent with us. I thank you, Michael, for continuing to put up with us. And I'm sure your staff have vicious things to say about us at time to time, and I appreciate you not saying it to our face. But we adore the program. We want expansion. We need more beds. We're growing. We're at a 500 population right now of offenders, and we're not seeing a reduction in the number of offenders coming our way. So I'm very grateful, and I wish you the best of luck in this entire effort. Thank you.
And Carolee Jones is the Executive Director of Child Advocacy and Parenting Services here in Salina. Come on up, Carolee.
Okay, Annie just stole my notes because she said that I could come up if she didn't have them. I don't need them. So, but anyway, it is a pleasure to be here. I've been director of CAPS, Child Advocacy and Parenting Services, for 22 years. And I can tell you that the prevalence of substance abuse in the maltreatment of children is enormous in our community, but throughout the whole nation. At this moment, I have 3 social workers and 4 CASAs that are in SYNC court, which is Child in Need of Care. These children have been placed out of their homes in foster care because of substance abuse and abuse of the children themselves. They are working right now with those families in CKF to make sure that the children can be reintegrated with their natural parents. The issues of child abuse and neglect, and we are focusing on that in April, are varied, but substance abuse is always a part of it. And so if I would like each one of you to join us and myself in pledging towards the matching grant for the Maybe Foundation, and if not for the parent who is suffering abuse and neglect, then let's do it for their children who deserve a safe, stable, and nurturing relationship. As a United Way partner and working in the community, it's been a pleasure to have the resources and being able to refer families to CKF. We cannot even start to work on the parent-child relationship until the issue of the substance abuse is mitigated. So I want to thank you on behalf of the kids and upon our community for the extended services that CKF can provide. She took my notes. I'm taking yours.
Trickle down effect. Thanks to all of you for sharing your relationships and experience with CKF. Likewise, CKF doesn't exist without the work that all of you do as well. So thank you for that. Just want to talk a little bit about the numbers of the campaign. As I mentioned before, it is a $2.5 million comprehensive capital campaign. $1.5 million is to renovate and expand our residential detox and treatment capacity from, as Les mentioned, from 20 beds to 30 bed capacity in a semi-private room situation. $500,000 to renovate the Pathfinder Recovery Center, and $500,000 to endow CKF for for future generations. So we are delighted to announce today that through the generosity of many local corporations, charitable foundations, private individuals, that we've received gift and pledges totaling more than $985,000. In January, we received notice from the J.E. and L.E. Mabee Foundation of Tulsa, Oklahoma, that we had received a $200,000 challenge grant. We are delighted and honored to have that grant. However, to meet the challenge, we need to meet that $200,000 challenge, we need to raise $365,000 prior to January of 2015. So we've got a lot of work ahead of us, and we'd like to ask all of you to support the campaign and to ask your friends to support the campaign. To close out the overall campaign, we need to raise $1.5 million to close out the campaign, and we'd love for all of you to help spread the word so that we can do that. We have just a few more minutes before we wrap up, and Les and I'd be happy to take any questions that you all might have.
I just want to mention a couple of other things, just from a need perspective. In 2010, CKF admitted about 80 people for detoxification, and once we started working with the medical community in the hospital, we project 260 admissions this year. So you can see the type of increase that we're seeing. That's not all Salina, but it's from a regional basis, so the demand is really what is driving our efforts. We also provide medication-assisted withdrawal, which is not commonly done in the state of Kansas outside of the hospital, and so that helps move those people from an acute care setting to a community setting and benefits everybody. So just wanted to share those numbers.
Any questions? No? All right. Well, thank you to our friends in the media for coming today, and thanks to all of you for coming. We appreciate it.
Thank you, guys.
We do have some snacks and coffee.